Hey, I'm Dr. Harry McCleary, and thanks for clicking on my video. If we haven't met already, I'm a licensed clinical psychologist and a Navy veteran. And I spend the majority of my week conducting clinical research and treating active duty service members with PTSD. If this isn't the first time we're meeting and you're wondering why I'm wearing a hat, that is because I haven't figured out what to do with my COVID-19 stay in place hair. So, full transparency on this video. I wanted to spend a little bit of time talking about flashbacks and what flashbacks are and what they're not. If you watch movies on war veterans or Vietnam veterans, or a popular one is Rambo or First Blood. If you haven't seen Rambo, First Blood, I suggest it. It's classic. But flashbacks depicted in these movies and depicted in the media often portray these quote crazy veterans that are ready to get set off at any time, and they end up going in these almost psychotic episodes in which they don't know what's going on, who's around them, and they think everybody's the enemy. Okay. Well, typically that's actually not what a flashback looks like. A flashback is when someone starts to actually feel or think that they're actually back in the time of when the trauma actually occurred. Like most symptoms, flashbacks fall on a spectrum. So for some people, there are those times in which they actually feel and act as though the actual trauma is happening again, and they can't, see the other people in the room. The walls fade away. They feel like they're back actually in the time of the trauma. For some people, it is that vivid. But for the majority of people that experience flashbacks, it's not that vivid. Sometimes it is more of a film that is over your vision. You're driving down the street and your trauma was related to driving, and you start to see different things. You're still driving down the street, but you start to see different things that were familiar to you during the time. Flashbacks also aren't limited to these visual images that people see. Sometimes people smell something that reminds them of the trauma, that takes them back to that place. Sometimes people are hearing things that are taking them back to those places. And when I say hearing things, I do mean that, maybe you hear a bird chirping that it was chirping during the time, and that brings you back to this moment. Maybe those birds aren't even actually chirping in reality. Maybe you're smelling the cologne of somebody that sexually assaulted you, even though there's no one around you. These are versions of flashbacks as well, and they can often be very off-putting and very triggering to a lot of people. Flashbacks can be very scary, and the last place that somebody wants to be that has experienced the trauma is back in that same place. But flashbacks are different than thinking about the trauma or dreaming about the trauma. And this is where it often gets confused, because people often have these intrusive images or intrusive thoughts regarding the trauma. And those are both symptoms of PTSD. However, they are not flashbacks. When flashbacks occur, people start becoming confused about where they actually are. They end up having these images to the point where they can't really tell if it's happening or not right now. Most of the time when somebody is thinking about it, or they're dreaming about it, or they're being triggered by something, they can tell that it's not actually happening again. Now, they may react as if they're going to prevent it from happening again, but they don't actually feel confused about where they actually are. They realize that they're in their house. They realize that they're driving down the street. They realize that they're at work or at the mall or whatever. Those type of things aren't flashbacks. The last point I want to mention about flashbacks is related to how people feel flashbacks are really the core or most important symptom of PTSD. And that is just not the case. Flashbacks are one symptom of PTSD. And just because you don't have flashbacks or not having these visual images that are popping to your mind and you're confused where you are, does not mean that you do not have PTSD. I want to make that clear because many movies and media even will portray PTSD in a certain way that seems like flashbacks are actually what PTSD is. And I'm here to say that flashbacks are just one part of how PTSD can manifest with somebody, but it is definitely not all of PTSD. And the majority of people that I actually see, and the majority of the people that I've seen over the years, actually don't experience flashbacks. And they definitely still have PTSD. Something to think about. I hope you found this video helpful, and if you did, please click the like button. And if you did find this helpful, that means that it will probably be helpful to somebody else. So I ask that you please share this information with a veteran. Share this information with the active duty service member that's in your family or your friend, because at the end of the day, that's what this is all about. One veteran trying to help another.